All right, so this is Jordan from Epilepsy Services of Southwest Florida. Thank you, Jordan, so much for joining us. And we're
Yep.
looking forward to what you have to share.
Okay, awesome. Um, so I just need to share my screen if possible. Let's see if it'll let me. It just says the host disabled screen sharing.
I should be able to make you the host to make that happen. There you
Let's see. Awesome. So, alrighty. So this is the general PowerPoint that we use for all of our presentations, but it really does cover everything that we discussed as being in the presentation. So we're Epilepsy Services, Southwest Florida. I know Lionel had mentioned to me that we've done presentations with you guys in the past. But where we'll start off with is, what is epilepsy? It's a neurological disorder caused by malfunctioning nerve cells activity in the brain. These malfunctions cause episodes known as seizures. It's more common than I think a lot of people know. I didn't know anything about epilepsy until my son was diagnosed with it at 14 months old. He's 7 now. We've got really good seizure control, but with us, coming into the community of epilepsy, I was really blown away by how many people do have epilepsy. It says my internet connection is not great. Is everything seem okay on your end?
Yes, you're good.
Okay. So here's just some statistics to kind of give you an idea of epilepsy and the amount of people that it affects. 1 in 26 people worldwide, 65 million people in the world. Epilepsy is defined by having 2 or more seizures that are more than 24 hours apart. So you can have a seizure disorder and not have epilepsy. Epilepsy is diagnosed with testing, whether it be an EEG, where the neurologist is reading the brain waves. MRIs are also necessary testing that we do, but it can happen at any age, and it is the most common neurological disorder. I know this was big for you guys to know. Common seizure triggers. Stress and anxiety is a huge one. A lot of our clients report seizures, and they're like, well, I didn't mess my meds or anything. I don't know what's going on. And the big two stressors that we find are stress, anxiety, and lack of sleep. Change in hormones for women around their menstrual cycle can also be a time that seizures are heightened. Missing meals, flashing lights, skipping medications, illness and fever, and alcohol and recreational drug use are all triggers for seizures. This is a video that it's a little bit lengthy, but it really gives a good in-depth view on epilepsy and triggers, and kind of just it describes the different types of epilepsy. Dr. In this video, there are looking for answers for yourself or somebody learn to give you the best information. First of all, epilepsy is common. But now I am to learn and ask for epilepsy. Third most common neurological disease after migraine, stroke, and Alzheimer's. Epilepsy happens as a result of abnormal activity or synapses. Or the electrical storm is something. And because the brain uses so much, different things to be done. And that creates a liver bleeding. And one sense is that we two main hormones. Our body is like people are probably and counterparts. Especially initially in birth. And the same marks about epilepsy. There are someone experiences to be trying to find anything to learn. They can't just from Japanese framework.
And don't worry, epilepsy isn't contagious, so you can't. Children are under adults and nurses below. Anyone who's about epilepsy. And epilepsy is diagnosed in older years. Sometimes by never know about English, but so other then about half the people with epilepsy eventually know it. Because they happen in the brain, the seizures can affect unprocessed brain networks. Therefore, symptoms can vary. When individuals with epilepsy tend to have the same epilepsy each time, but somewhat background effect. So, as you do recognize the seizure, keep an eye out for temporary confusion, a staring spell, uncontrollable jerking, loss of consciousness, fear, anxiety, and addiction. Let's talk about the two types of seizures again. Papa and John Cox. Papa seizures work in one of two ways, without massive awareness or with impaired awareness. In most, where you remain conscious, you may experience altered emotions or change in sensation of smell, sound, taste. You may also have dizziness, tingling, or sensational eyes. You can also experience a large range of body parts. When they lose or have altered awareness, they can pass out or swim into space. Then rubbing, chewing, swallowing, because these symptoms overlap with migraine or other or psychological. Some seizures are done by stimuli, sometimes into space, rather than maximum point of pressure and effort. Tonic seizures are done sticky like a back. Atomic seizures, which present to a massive instead of being stiff, and will be useful. Seizures usually affect the work and instinct. Similar to panic seizure, even after having a similar seizure, such as the diagnosis of epilepsy, regardless of the details of the epilepsy of the first seizure, see a physician. Will assess the things as for towards others. If it would have a logical activity, blood tests, with a chain, control scanner, relative, because your brain is something one of something and that's kind of such a
So that is the video. Ooh. Get out of here. Sorry. There we go. So types of seizures they kind of touched on are the focal seizures, focal awareness, and focal impaired awareness seizures. The generalized seizures are more of the ones that are a little more common. The absent seizures affect when a person, you'll see them just kind of staring off blankly, and the tonic-clonics are the ones that are, the full body convulsions, losing consciousness, and things like that. There are ways to monitor epilepsy, and one of those ways is with a seizure response dog. There's a little video on here. It just kind of shows what seizure response dogs do. Not all dogs can sense a seizure before it happens. People who have a dog that can do that, it's not something they can be trained to do. It's just something they can naturally do. But they're more there for comfort than anything. They help to get up underneath the patient or the person there when they regain consciousness. Another one is the Embrace Monitor. This is the older version, but I actually have this for my son. And it will watch, or a wearable band that senses movements and then changes in the skin. And it has a GPS locator on it where if it thinks that you are having a seizure, you can obviously stop it if you're not, but it connect contacts within the program, and it sends a emergency signal with your location and a notification that that patient or that person may be having a seizure. Epilepsy first aid. I have a lot of brochures in the office for epilepsy first aid. Some are just very simple bookmarks that give you a really quick breakdown on what to do. And then there's some more that are a little more involved. I'd be happy to send some to you guys if you'd be interested in that. And then also to rewind back a little bit with the seizure journal that it was mentioning in that video, we also have seizure journals in the office. And if you know of anybody who would be interested in having one, I would be happy to mail those over to you guys as well. But for the seizure first aid, first and foremost, stay calm with the person until they are alert and awake. Want to create a safe space, so nothing that can fall on them, nothing that they can knock over. We want to roll the person on their side and cushion their head as best as possible. It's really important to note the length of the seizure. When you're in the moment of having one, seconds feel like hours. So if it's something simple like looking at a clock or your watch, just to monitor that time frame that that person is having a seizure. And then just providing reassurance, letting them know that you're there and that they're okay, and that if in the context that you call 911, if the seizure lasts longer than 5 minutes, letting them know that help is on the way. So not only, are we calling 911 if a seizure lasts more than 5 minutes, but if the seizure happens with the person in the water, if the person is pregnant, injured, or sick. You don't want to restrain the person, and you definitely don't want to put anything in their mouth. As the movie or the video said, it is a myth that you can choke on your tongue. Seeing someone having a seizure really looks like they could be choking, and a lot of people, their breathing is so shallow. My son, for instance, he turns blue, so it looks like he's not getting oxygen, even though he is breathing. It's just at a very light rate. So don't put your finger or anything in the mouth. Chomp down on the finger, and then you've got an issue as well. A lot of issues too we see with patients is they bite their tongue in their cheek. How we help our patients with epilepsy. We are a nonprofit organization that I didn't know anything about before I went in to interview for the position. And being part of the epilepsy community, I was really amazed at what our organization does within the community. We have patients, we specialize in taking care of patients who have no insurance or who have insurance that doesn't cover their neurology expenses, Or patients, we find more common, they have insurance, but there isn't a provider within like 50 miles. And under Florida law, if you have a seizure, you aren't allowed to drive for up to 6 months. So getting to appointments can become an issue as well. So we have 4 volunteer doctors, 3 that work out of our office and 1 that works out of his own, and they volunteer their time to see our patients. We have 411 patients between the 8 counties that we cover. So we make sure that their medications are filled, routine appointments are scheduled, and recommended testing is completed. Everything is done at no cost to the patient, no matter what it is. We also can assist with 1 month of rent payments. We can cover 1 month of medication. If the patient needs to have it filled immediately through a pharmacy, then we can cover the cost of that medication for them. We provide assistance in getting in support groups, and then obviously in first aid training. We are big on safe transportation. We have our financial gentleman in the office. He also has a nonprofit medical transport company that we utilize. We give out free bus passes, 30-day bus passes, and we also keep helmets in our office for our clients who ride their bicycle. But most importantly, we try to provide a comfort and welcoming face, a smile over the phone, and an open ear and a calming atmosphere. We have a lot of patients that just come in to talk. If a patient has insurance that is something they can use, we will still keep them on as case management only. So we can't provide them with a doctor, but we can help them with all of the other fields. Encouragement. Caring for someone who has a seizure can be scary and stressful. Follow the steps in the presentation and call 911 if necessary. This can be daunting for anyone with a caring heart. We're here for anyone who needs support or just someone to talk to when they are caring for someone with epilepsy. A hero is an ordinary individual who finds the strength to persevere and endure in spite of overwhelming obstacles. And then here's our contact information. Summer is our program manager. She's usually the one who covers our presentations, but she is out for the next couple weeks. So you guys got me. I'm a case manager there, so I can answer any questions that you have moving forward, or if you want to ask them later on, here's my information as well.
Awesome. Thank you so much, Jordan. Did anybody who's on here have any questions? Well, awesome. Thank you so much. Like I said, I'll share the presentation with those who had signed up.
Okay.
I actually do have one question. You talked about the armband for like monitoring. We have other individuals, with seizures, especially while they're sleeping. We've had, some family members asking, do you have any other like adaptive equipment or things that can, help with?
Yeah, the only other one. So if they have an Apple Watch, there is a seizure monitoring setting on Apple Watches. I don't know if they have that on Android. I can find out, but I know specifically Apple has settings within their programs. And then there's one that is it's a almost like a mattress cover that goes in the bed, and that also is going to detect any abnormal movements. So the only types of seizures that really it is going to pick up, obviously, are those ones that are causing the movement in the body. The tonic-clonic seizures, or the atonic seizures, or clonic seizures, the ones that are causing the convulsions, those are the only ones that it would be able to monitor. There is another organization called Josh Provides, and they're a nonprofit based out of Sarasota. And I've been working with them lately. We have a patient who has a brain tumor, and he doesn't have any insurance, but I found through them a lot of helpful information. Whether you're insured or not insured, they with my particular client, they're giving him $1,000 towards his medical expenses to see a specialist, but they also are covering the wearable devices. There is a monthly fee associated with the wearable device. I want to say, it's like maybe $10, $20, and then it can go all the way up to like, I want to say $40, but the $40 one, you've got like 8 contact, it's a little more involved, but for the basic function of alerting at least one person, you can get by with the minimum membership there. But joshprovides.org, they have a ton of resources. Seizure response dogs, they also provide financial assistance towards obtaining a seizure response dog. They're a really, really, really great organization. They also do transportation in the way of they provide Uber and Lyft gift cards to those who need them.
Awesome. Thank you so much.
Mm-hmm.
All right. Well, thank you so much again. Like I said, we have this recorded, so send it out to anyone who wasn't able to make it tonight. And really appreciate you coming and sharing your knowledge with us.
Yeah, of course. And again, if you guys want any of the pamphlets, the bookmarks I find are super helpful. They're very small, but they're very useful. In seizure first aid, they have everything listed there for you. And then also the seizure journals. If anybody is interested in a seizure journal, those are all things that I can mail to you.
Yeah, that'd be great to have some of those.
Okay. I'll get with you via email and see where you'd like to send those or like me to send them.
Perfect. All right. Thank you so much, everybody.
Okay, awesome. Have a great night.